most pregnant women in South Africa will have to wait at least another month for a COVID-19 jab. The National Vaccination Rollout Coordinator, Dr. Nicholas Crisp, says adding pregnant women to existing special priority groups will be too complicated and would take 3 weeks or more. The SA Society for Gynecologists is concerned and calling for all women of reproductive age to be vaccinated as soon as possible. To expand on this conversation, I'm joined now by the association's Professor Priya Soma-Pillay. A very good morning to you, Professor, and thank you for your time. You've expressed a lot of concern, saying that there are concerns around COVID-19, which is creating a generation of orphans. Let's talk about what you've been seeing throughout the past few months.
Morning, and morning to your viewers. Yes, we've been seeing an increased rate of maternal morbidity and mortality over the last year and a half since the COVID pandemic has begun. We've observed that pregnant women who get infected with COVID and require hospitalization have a greater need for mechanical ventilation than non-pregnant women in the same age group. Data from our South African obstetric surveillance system has shown that pregnant women admitted to hospital, about 1 in 16 require mechanical ventilation. 1 in 6 require mechanical ventilation, and about 1 in 16 women admitted to hospital will die. So we are quite concerned about our pregnant cohort. Majority of our pregnant women fall into the 20 to 35-year age group, and they've not yet been prioritized for vaccination unless they form part of the essential services, that is the police, healthcare workers, or teachers. We are looking forward to our pregnant women being vaccinated come the 1st of September.
The Department of Health, Dr. Nicholas Crisp, has expressed some concern, saying that should the moves be made now, it will further complicate matters. What elements would he be talking to there?
I think this is just more from a logistics point of view. There are other groups that have also requested to be prioritized, patients with immune system conditions, transplant patients. So I think the decision is more a logistics in nature, and it's difficult to prioritize every group that is requesting early vaccination. And the Department of Health has therefore then used the age group rollout rather than to prioritize specific groups.
And when it comes to perhaps some expert advice that you would give out to those who may be thinking of getting pregnant, or just when it comes to the precautions that need to be taken with COVID-19, and those who are already pregnant, where do they fall when it comes to the vaccination, as well as the calls that you're making and advocating for very strongly?
At this point, we recommend and we strongly encourage all women planning pregnancy to get vaccinated prior to pregnancy. If you are planning fertility, or if you are planning your pregnancy, and if you do become pregnant while you're in the middle of your Pfizer vaccine, if you're between the 2 doses, there's no reason to delay the 2nd dose. Women receiving fertility treatment are also encouraged to continue with their treatment. Once you are pregnant and haven't received the vaccine, the recommendation from the National Department of Health is that women delay the vaccination until 14 weeks of gestation. Prior to 14 weeks, this is the period when the fetus is most vulnerable, and we're particularly worried about some of the side effects with the vaccination, particularly the febrile effects. So the recommendation from the Department of Health is to delay to after 14 weeks. But after 14 weeks, we encourage all pregnant women to get vaccinated. There's benefits for both the mother and the infant. In terms of the mother, the risk of infection is lowered. Her morbidity and risk for hospitalization is also lowered. And in terms of the fetus, there is a passive transfer of antibodies that has been observed both in the cord and in breast milk. So the fetus is protected by vaccination as well. When looking at the immune response following vaccination, several studies have found a higher immune response following vaccination than natural infection. So we do believe that vaccination is the way to go to reduce our maternal morbidity and mortality.
We've just heard the Gauteng Premier, David Makhura, a short while ago saying that a lot of people are still succumbing to COVID-19, and this is something that's really concerning at this stage. And, you know, the research that's come out is to explain that a lot of women in their third trimester are also succumbing to COVID-19. Is there any data or perhaps some research that will indicate why specifically that third trimester is so vulnerable?
So there's no risk in transmission between the different trimesters. The risk of transmission is the same between first, second, and third trimester. However, one is most vulnerable to becoming ill and being admitted to hospital in the third trimester, and this is related to the physiological changes in pregnancy that are more prominent in the third trimester. Particularly, one's lung capacity is decreased as the uterus expands. It exerts pressure on the thoracic cavity, and your lung volume is decreased. So this is one of the reasons, but there are several other reasons related to physiological changes that are just more exaggerated in the third trimester.
And very lastly, before we let you go, being pregnant is a very complicated process. I mean, there are medications that you're not supposed to be taking. What would you then advise to a woman who may find herself pregnant and infected with COVID-19 and is now looking at over-the-counter methods of you know, curbing the virus and healing?
Any pregnant woman who becomes infected should contact a healthcare practitioner regarding medication she should take. Most of the over-the-counter medications, in terms of the vitamins in the multivitamin format, are safe. One needs to check on the antibiotics because some are safe in pregnancy, but some not. So it's important to contact your healthcare provider regarding medication that can be used. It's also important that pregnant women monitor their temperature because this can have an adverse effect on the fetus, and monitor their saturations if she's being cared for at home. But it's important to have contact with a healthcare provider so that her infection process is being monitored by a healthcare provider.
Very well. Thank you so much for your time and weighing in on that conversation there. Professor Priya Soma-Pillay weighing in there, saying that vaccination for most pregnant women in South Africa is something that should be looked at very urgently, and calling for that process to get underway as soon as possible.